Hello everyone! Welcome back to MJ Pharma. Today, we are going over the drug of choice for common endocrine disorders, including diabetes, thyroid conditions, and adrenal issues. Let's get into it. Drug of choice for acute and chronic adrenal insufficiency. Hydrocortisone, shortest-acting glucocorticoid. Drug of choice for congenital adrenal hyperplasia. Hydrocortisone. Drug of choice for tumor-induced brain edema. Dexamethasone, long-acting glucocorticoid. Drug used for mineralocorticoid replacement. Fludrocortisone. Drug of choice for premenstrual syndrome. SSRIs like Fluoxetine. Drug of choice for dysfunctional uterine bleeding. NSAIDs, indomethacin. Drug of choice for androgenic alopecia. Finasteride, 5-alpha reductase inhibitor. Drug of choice for hypothyroidism. Levothyroxine. Drug of choice for hypothyroidism in children, cretinism. Thyroxine. Drug of choice for myxedema coma. Levothyroxine. Drug of choice for reducing thyroid gland vascularity. Potassium iodide. Drug of choice for hyperprolactinemia. Bromocriptine. Drug of choice for acute gout. NSAID, indomethacin. Drug of choice for chronic gout. Allopurinol, xanthine oxidase inhibitor. Drug of choice for thyroid storm. Propylthiouracil. Drug of choice for making patient euthyroid before surgery. Potassium iodide. Drug of choice for thyroid cancer. Levothyroxine. Drug of choice for Graves' disease. Methimazole, antithyroid drug. Drug of choice for thyroid ablation. Iodine 131. Drug of choice for thyroid storm in India. Potassium iodide. Drug of choice for reducing somatic manifestations of hyperthyroidism. Propranolol. Drug of choice for diabetic ketoacidosis, DKA. Regular insulin. Drug of choice for pheochromocytoma. Phenoxybenzamine, alpha blocker. Drug of choice for acute hypercalcemia. Furosemide, loop diuretic. Drug of choice for hypercalcemia due to malignancy. Bisphosphonate. Drug of choice for vaginal atrophy. Topical estrogen or HRT. Drug of choice lithium-induced diabetes mellitus. Amiloride. Drug of choice for steroid-induced osteoporosis. Zolindrate, bisphosphonates. Drug of choice for osteoporosis. Raloxifene, SERM selective estrogen receptor modulator. Drug of choice for prostate cancer. GnRH analogs like buserelin. Drug of choice for neurogenic diabetes insipidus. Desmopressin. Drug of choice for nephrogenic diabetes insipidus. Thiazides. Drug of choice for acute adrenal insufficiency. Hydrocortisone, I.V. Drug of choice for postprandial hyperglycemia. Nataglinide, maglitinide derivative. Drug of choice for type 2 diabetes mellitus, DM. Metformin, biguanides. Drug of choice for type 1 diabetes mellitus, DM. Regular insulin. Drug of choice for diabetes mellitus in pregnancy. Regular insulin. Drug of choice for uncontrolled diabetes mellitus. Regular insulin. Drug of choice for diabetic ketoacidosis. Regular insulin. Drug of choice for diabetes in renal and hepatic failure. Regular insulin. Drug of choice for controlling glucose level during infections and diabetes. Regular insulin. Drug of choice for diabetes and renal failure. Repaglinide, maglitinide derivative. Drug of choice for prevention of breast cancer. Tamoxifen. Drug of choice for prevention of diabetes. Metformin. Drug of choice for severe hypoglycemia in case of insulinoma. Diazoxide, potassium channel opener. Drug of choice for emergency contraception. Mifepristone. Drug of choice for polycystic ovarian disease. Clomiphene citrate. Drug of choice for oligospermia. Clomiphene citrate. Drug of choice for corpus luteum insufficiency. Clomiphene citrate. Drug of choice for anovulatory infertility. Clomiphene citrate. Drug of choice for postcoital contraception. Mifepristone. Drug of choice for hirsutism. Cyproterone acetate, androgen receptor antagonist. Drug of choice for large prostate. Finasteride, 5-alpha reductase inhibitor. Drug of choice for inducing labor. Oxytocin. Drug of choice for benign prostate enlargement, BPAH. Tamsulosin. Drug of choice for postmenopausal osteoporosis. Raloxifene or bisphosphonates. Drug of choice for prevention of postmenopausal osteoporosis. Vitamin D and calcium. This video is for educational purposes only. Always consult a licensed healthcare provider before starting or recommending any treatment. Thanks for watching. If this helped, like, subscribe, and hit that bell icon to stay updated with MJ Pharma.